Hello and welcome. We are at WHO Traditional Medicine Global Summit at Gandhinagar, and we are joined by WHO team lead for traditional medicine and senior strategic advisor, Dr. Shyama Kuruvilla. Dr. Shyama, very welcome to Doordarshan.
Thank you. It's an honor.
Yeah. Dr. Shyama, I just would like to ask that what is the summit about and what are the goals and objectives of the summit and what's the experience till date?
Thank you, Utsav. It's been a marvelous experience because we have participants from all around the world sharing their experiences, their traditions, the science, the innovation in traditional medicine. The focus is on traditional, complementary, integrative medicine. In short form, we are just saying traditional medicine. And the purpose of the summit is that all of our WHO member states, so it's countries from around the world, at the World Health Assembly this year in May, requested WHO to develop a global strategy, an updated evidence-based global strategy for 10 years. So it would be from 2025 to 2034. So this is the start of that conversation to get inputs from people around the world. And the idea is to mobilize political commitment and collective action based on science and innovation. So we had an opening video that said, unlock the power of traditional medicine using science and innovation. So that's the overarching theme.
It's a really wonderful thing. I would just like to ask that because we have lots of cultural and geographical diversity, we have a long heritage, long history of many things. So how to define traditional medicine? What's the definition of traditional medicine? So understanding that what are the values that we derive from different cultures, peoples and nations?
Thanks, Utsav. So again, TCIM, I'm calling this traditional medicine, has a long history in every country. And it's very different, as you say, there's a lot of diversity. But at the opening of the summit, the First Lady of Turkey, who is a big promoter of health, says we really need to look at our own contexts and understand where we came from, where we're going. And she said, sometimes when we look at diseases, we say, oh, this disease is because of this climate or these organisms that are very specific to a country. And she said that way the healing also can be very specific to each country. But what we're trying to do as WHO is to learn from each country and look at what's the global evidence and also facilitate sharing of best practices. And WHO is the lead technical agency in the UN for health. So all of this we do by applying a science lens. And we're not going soft on science, we're going hard on science. Everything in traditional medicine will be the same rigorous standard as in any other area of health. But we're also going hard on science to say, okay, we're not looking, and you know this with your pharmaceutical background, just at one active ingredient or one molecule, but we're trying to see how can science understand what works when we look at holistic approaches to health, of personalized approaches to health. So it's a different scientific challenge. So we're hard on science, on the rigor and robustness, but also on the methods to understand the world differently, but in a rigorous way.
Ma'am, when we talk about allopathic sciences or the modern sciences which deal with medicine, so we have a very unified understanding of systems and how bodies work and genetics and everything. How will you unify the understanding of all traditional medicines, or will there be in particular respective traditional medicines will gain a very much unique wisdom out of the experiences that or evidences that you are going to gather? So what's progress on that, and what is your views about that?
Very interesting question. So these are the questions we are discussing at the summit. But just to say, you're exactly right. You have to start with an understanding of health. And you said we have an understanding of the genetics and the physiology. But I think in traditional medicine, the idea is also holistic. What do you know about the person's own skills, their lifestyles, their society, their history, their spirituality, and looking at a person in the entirety, and which might not be part of the pharmaceutical equation. And so it's saying, how do we get to more personal understanding of health, but at the same time based on a universal understanding and approach to guiding the approaches to improving people's health and well-being. So for WHO, that means, are the interventions, whichever traditional medicine system they come up from, can they be tested scientifically, rigorously? Can we ensure they're effective? Can we ensure that people are safe when using it? And this also means understanding what does not work. So are people using something from belief but not necessarily based on science that will prevent them from accessing urgent life-saving care? Because that's dangerous as much as using the wrong thing. And also, if you're using it in a complementary way, what are the drug interactions and side effects? So WHO, in terms of standards, not only on research, on data, there was a presentation on the International Classification of Diseases, version 11. And here, there is the integration of traditional medicine conditions, interventions, in a standardized way globally. So the first chapter was more on the traditional Chinese and Asian medicine systems, so Korea, Japan, China, and looking at what the commonalities are, coming up with standard terminology. And now it's a chapter on the Ayush, the second module. And so this will really revolutionize. So whether it's private sector, public sector, what are the conditions you're seeing? What are the interventions? Panchakarma, and what are the outcomes? Can you monitor them? So if clinics start using this, we build up that evidence base as well.
Wonderful, ma'am. When last time when WHO DG visited India, he said India has to go to the world and world has to come to India. So what role can play India for in contribution of traditional medicine knowledge and wisdom to the world?
India plays a very important role, being one of the most ancient cultures and systems of traditional medicine. I think you were saying when you toured this exhibition, you were struck by how allopathic medicine may be a few hundred years of history, but these are thousands of years of ancient history from the ancient Persia, Egypt, and India has been at the forefront. I think it's important for everyone to realize that traditional medicine has been at the forefront of landmark scientific and medical discoveries. We forget that sometimes. We look at aspirin, most common drug. This came from the willow bark. We look at smallpox eradication, which was a global health success. And there were in India, in China, in Persia, people already doing the variolation, which led to the vaccine, practice of the vaccines and so on. Childhood cancer treatments from Rosie Periwinkle. There are and artemisinin, Nobel Prize laureate Professor Tu Youyou, which is a WHO recommended first and second line treatment for malaria. So India now is really combining the ancient and the modern. Secretary Kotecha from Ministry of Ayush was talking about the Ayush grid that's enabling with artificial intelligence bringing this into personalized care, that people have their own choice and power on which systems to choose and why, and supported by evidence and quality standards. So I think it's both the ancient tradition, the modern science and innovation. I think the spirit of entrepreneurship and welcoming of science and tradition together, I think this will be really catalytic. And as you know, the government of India has very generously supported WHO's capacities to scale up WHO support to all members globally. As Honorable Prime Minister says, Vasudhaiva Kudumbakam, and in that spirit, the new WHO Global Centre in Jamnagar will help scale up these capacities in research, in data, in digital technologies and innovation, and also biodiversity, which is the planetary health aspect. Because the earth that nurtures us, if we don't nurture it back, we're going to lose our health, our well-being. So I think the health of people and the planet is very closely interlinked, and that's one of the main messages coming from the summit as well.
Yes, I feel, ma'am, as we are moving in the era of the artificial intelligence, what we are talking about is the natural intelligence which resides in our systems and our ecosystems and our cultures. I would like to ask that we have fought a very long pandemic, this corona pandemic that we all are fighting, we have fought. Is there anything that you can share from your experiences where traditional medicines might have played a role in combating such pandemic? And do you also feel that in future we can also fight such pandemics with the help of traditional medicines?
Okay. So WHO has a clinical trial registry that you might be familiar with. So all trials are registered there, and there were, during the pandemic, around 350 to 400 trials registered at WHO. But there were many more, not just traditional medicine. This is on traditional medicine, the 340 or so. But overall, there were many more. And the same as for conventional trials and for traditional medicine trials, very few of those interventions were proven to be effective at the level that's needed for a WHO guideline, because it's very robust, rigorous scientific criteria. And part of the reason was that the studies were not really conducted with an appropriate sample size that gives the power of the evidence, and also the methodology wasn't strong enough. So I think a plea from WHO is, we welcome all the science, but to make sure that it's done in a high quality, rigorous way so that these can be considered in the aggregate for making policies.
So it's a really wonderful thing that you are sharing, ma'am. I would just like to ask that because as a global leader leading with traditional medicine program, you might have come through various systems of traditional medicines. What kind of wisdom that you have got personally, and as a doctor, and as an organization WHO has got to see around the world?
So one of the things is, WHO has been working on traditional medicine since 1976. So there's a core traditional complementary integrative medicine unit that focuses on developing the standards and benchmarks. So for example, on yoga, there maybe people practice yoga in different ways, but looking at the from a policy and science lens, what are the standards, what are the benchmarks if you say you're giving yoga as an intervention? So there are benchmark documents being developed for all traditional medicine systems. So even on acupuncture, which is traditional Chinese medicine. So this is one start that the group is doing. We also have our regional offices. And as you've said, every traditional medicine system is very different around the world. So our regional offices and our regional colleagues and participants at the summit are sharing their experiences and very different practices. But I'm going back to one of your earlier points, trying to see what are the commonalities. Do we have a shared understanding of what is human health? What dimensions are we looking at? We have our indigenous communities who say there is a wisdom that has come from our ancestors, and maybe they didn't know science, but they have understood the world in a way that we don't. And your question about coming out of the COVID pandemic, people realized, oh my goodness, our health is really interlinked with our environment. If something changes, we get a new virus or the pandemic. So how do we get back into balance? And so people are looking back and saying, so for example, New Zealand, not their traditional medicine strategy, but their national development and treasury strategy is based on ancient Maori wisdom, reflecting this reclaiming of the ancient and modern based on science to really drive people's, individuals and national development, so that it's towards health and well-being and not towards just making money or the economy. So WHO has also, the WHO DG had a commission on the macroeconomics of health for all, saying how do we reorient economies to ensure that everyone's health and well-being is the purpose of our policies and not just the economy. The economy is there to help well-being of people and the planet.
Yeah, ma'am. As in India, we think Indian philosophy, the body is a miniature version of the universe. That's how we understand the bodies and we treat it. So we are so connected. Indians are so connected with the entire universe. Ma'am, another question is that as we are sitting in Gujarat, so we have a district called Dang. It's a tribal district. So one time I was visiting that district and I found some people who are using traditional medicines. So I asked him some blood-related disorders. So like if you're anemic, then they were using some plant called Ragat Rohiro. Now he is using it for locally for the tribal purpose and everything. But question is that objectively, if you put this into the context, practical context, okay, how do that person in Dang who is practicing and who is fighting anemia from his ancient wisdom will reach to WHO, and how WHO will reach to that tribal person, if you can put this into the practical context.
Okay. I'll give an example, and there are examples from India as well.
Yeah.
For example, the Traditional Knowledge Digital Library, TKDL, in India is an amazing example where there are focus groups and communities to understand what are their solutions and documenting this. And then that's the basis for starting some science. But I'll give you an example from Thailand. So Thailand is very well integrated, their traditional and conventional medicine systems. So they gave an example of the folk healers, like you're saying, in the tribes. And say there's a herb or a practice that's being practiced there. They also document, right? And they take videos and they understand. They bring this to the hospital. And the physicians look at this and, the health workforce. And then they have questions. So then they start a dialogue between the folk healer and the conventional medicine people. And then they say, okay, once they understand, they develop like an SOP, like protocols. And they apply this in the clinic and be very careful about what are the patient experiences, the satisfaction, the safety, the efficacy. And then once there's some test in use, they start the trials, the randomized controlled trials. And then once the evidence is in, they actually, and it's proven to be effective and safe and acceptable to people, they actually include it in the Thailand essential medicines list. And when it becomes like national policy, then this becomes something, because member states are WHO's governing body, comes to WHO. And WHO in turn can say, wonderful, from Thailand, and now from India and from others, we can put together the global evidence so that in turn informs the national policy and updates, and then hopefully gets through to the healers in Dang, for example. So yes, both ways.
So it's a really wonderful insight. It's really very exciting also to know that how WHO functions for such kind of knowledge. I would like to ask that we had a strategy on traditional medicine like way back in 2000, around first decade of 2000s, and then 2013 to 2024. So when do we expect the next strategy, and what could be the possible objectives of that strategy, ma'am?
So I think as WHO member states have extended the current strategy through to 2025, and the new one will be from 2025 to 2034. So WHO strategies are global. They set out the evidence-based guidelines, the directions, the priorities, and of course they have to be adapted in each country, again based on evidence and each country's needs. The kinds of themes are very much those that are reflected here. So coming out of the summit, there will be a research priority setting exercise, consulting all countries. There will be work on data and routine information systems. There will be the biodiversity and planetary health work stream, the partnerships and networks. So for example, these clinical networks, to look at whether we can do this internationally in terms of the data and sharing. And then also the artificial intelligence, the patterns we are talking about in terms of saying what are the commonalities. I think using artificial intelligence, it scales up our ability to look at those, but at the same time being very aware that we need to have the ethics in place, the safeguards, so that you don't leave behind the communities in Dang, for example, and that they get the credit. So at the opening session, the WTO Director General, Dr. Ngozi, talked about a new WTO policy that's coming into place where any patents have to explicitly acknowledge the traditional ancestral use of, say, a natural product or so, which is going to be game changing as well.
Yes, ma'am. With this knowledge and information, I would like to ask, we are in the last phase of the interview, just would like to ask that, how would you deal with the intellectual property rights of tribals or the indigenous people that were having the knowledge? Because it is sometimes one of the most debated things that how do we protect their intellectual rights as well? So what's your views or WHO's views regarding this?
So this is a very important area of work, and WHO is working very closely with WIPO, the World Intellectual Property Organization, with the WTO and others. And at the summit, and even though if you can't watch it live, it's live cast, so it's recorded, and you can watch the sessions on biodiversity and entrepreneurship, which discusses some of these issues. But there is a request from the indigenous populations that our knowledge should not be seen as inferior, say, to a journal article knowledge. We've developed this knowledge over centuries, we've tested it, it's from our lands. And they said we want it to be seen in a complementary way. So the TKDL, the Traditional Knowledge Digital Library in India that we talked about, is actually documenting some of these ancient practices and making it available to patent examiners, so who can then say this has had that history, so you have to acknowledge it and you cannot take out a patent on this side of it. And many countries are doing something similar, and now WTO is doing this globally. So I think this will be a game changer. And at the same time, the rights of indigenous people, there is the whole convention in the UN system as well on the rights of indigenous peoples. And intellectual property rights is at the heart of it. So I think indigenous people as well are being aware of this and demanding and claiming their rights. So I think it has to be an equal partnership with respect, mutual respect and understanding. And I think that way we'll advance the science as well as a co-chair of the summit is from the Cochrane Collaboration, which is the global systematic review evidence group, who said, we should reach a world where everyone understands evidence and evolves it together.
Ma'am, WHO keeps advocating universal health coverage. How traditional medicine will help me achieving that goal?
So in 2019, the heads of all states and governments at the United Nations said we should look at the integration of traditional medicine as relevant into national health, all national health systems. It hasn't moved forward as much, in part because of these evidence and practice gaps. But universal health coverage means that all people should be able to access the services you need for your health and well-being without financial hardship, right? So one of the challenges is that a lot of the traditional medicine interventions, they're not covered in insurance or covered in national packages. In India, they're co-located, for example, in the health and wellness centers. You have the conventional practitioner and the traditional medicine practitioner. But universal health coverage, there's a big gap right now globally for the Sustainable Development Goals. And if we look at the professions in traditional medicine, there are university educated graduates and professionals in traditional medicine systems. There are facilities that we're not actually taking and integrating into the national health system at a level that it could be. So already then you would bridge the health workforce gap, for example. And and then also the services and people being able to access the care that they choose, whether it's conventional or traditional, and understand the pros and cons of both.
I would like to ask what is the message to the viewers across the globe who loves traditional medicine, who wants to use this in a very safe and better manner. So what's the message to them?
Thank you, Utsav. This summit actually has been so inspiring because we have the privilege of learning about the traditional medicine systems from all over the world. and most importantly, the people's voices, who are billions of people over centuries have been using these forms of knowledge. And for WHO as a scientific organization, it is to say that these ideas are inspirational, and it's a starting point to now apply rigorous scientific methods to make sure that what people are using are safe, are effective, are acceptable in your own contexts and cultures, and that WHO is looking to apply the most rigorous standards of science and safety to ensure people's health and well-being, and at the same time to apply rigorous science to understand in a broader way than we do now what constitutes people's health and well-being and what can improve the health and well-being of people and the planet. It's a journey, it's a collective journey, it's a global journey, and WHO from a scientific, technical, policy perspective is there to support this journey.
Thank you, Dr. Shyama, for talking to Doordarshan.
Thank you, it's been a pleasure and an honor as always.
Yeah, so this was Dr. Shyama Kuruvilla was telling about how we can connect our roots of ancient wisdom and understanding to the fruits of modern understanding and wisdom. So thank you for being with us. Thank you so much.
Thank you.